without further ado, let's get into it. So I just have some slides here, just some quick review. So here are your trinucleotide repeat disorders. This will just be some review slides if you want to look at them later. Here are some high yield room conditions and associated antibodies. Here's some forms of vasculitis. So you want to think about this in terms of small vessel vasculitis, medium vessel vasculitis, then large vessel vasculitis. And I have the associated findings with each of these. These are high yield for step 1. Here are your main antibiotic classes and their mechanism of action. This is really high yield for step 1, 2, and 3. So I'll just have these for reference. If you have any questions, feel free to type in the chat. I have the chat up. And then here's a nice graph that is super commonly tested just regarding sensitivity and specificity. We can just go over this really quick. So just type in the chat for any answers, of course. So let's say, so we have our graph here, right? So here are your true negatives and here are your true positives. And basically when you have a test, it will measure, somewhere along this x-axis. And you pick arbitrary numbers. So A would be, you'd say the test is negative, and B, you could say the test is positive. But you'll get a lot of values like in between here. So what would happen to the sensitivity and positive predictive value if you increased the threshold required to call a test positive? So what would happen here? Would sensitivity go up or down if you increase the threshold required to call something positive? Sensitivity. So I think the way I word it is, so yeah, down. Exactly. Perfect. Okay, so we got there. So basically, like say you had, I don't know, just a random serum marker that we'll call serum marker A. And normally we would say that a serum marker or a level of 50 would be positive, but then we move that up to like 75. So your sensitivity will go down, but your specificity will go up. So what will happen then to positive predictive value? Will that go up or down? Yeah, it'll go up as well. All right, very good. All right, so this is super high yield graph. You just want to be familiar. I see this question literally all the time. It's like a board's favorite. So just know what will happen if you to sensitivity, specificity, negative predictive value, positive predictive value as you move this line north and south or left or right. All right. And then here's a ROC curve, also super high yield. Basically, this is a measure of your true positive rate on the y-axis against your false positive rate on the x-axis. And what is the like geometric shape that is the best perfect ROC curve? What do you want it to look like? So a right angle is the perfect ROC curve because that would basically be the area under the curve would be 1. All right, very good. So now we'll just get started with cases. So just go ahead and type in the chat when you have answers. So what syndrome is associated with gout, intellectual disability, self-mutilating behavior? Yeah, good. Yeah, Leach-9 syndrome. Do you know what gene is associated with Leach-9 syndrome or mutation? Yeah, good. It's HGRPT or PRT, I think. Good. All right. Now, what condition involves situs inversus or dextrocardia, chronic sinusitis, bronchiectasis, and infertility? Yep, Cardenegger. And what is the deficiency in Cardenegger syndrome? Yeah, it's a dynein tube defect. Very good. So here's an example of what do you see here on the chest X-ray? Yep, situs inversus. So this is dextrocardia, where the heart's on the right side. And what is this associated with that we just talked about? Yeah, yeah, Cardenegger. All right. And then here's your HPRT. pathway. Basically, you want to know that leishman is associated with increased uric acid production in here. So this is basically a end pathway of the ion. So you remember that this is I think this is testable for step one, but you have your um, purines, and then it goes down the PRPP pathway. IMP is the high yield intermediary, and then hypoxanthine is also high yield because IMP and hypoxanthine are involved in the HPRT pathway. And then the end product eventually will be uric acid. And the enzyme responsible for creation of uric acid is xanthine oxidase. What uh, drugs inhibit a xanthine oxidase? Yeah, the big one's allopurinol. Very good. All right. Now, what condition is characterized by blue sclera? Yeah, good. OI. Osteogenesis imperfecta. What syndrome causes elastic skin, hypermobility of joints, increased bleeding tendency? Yeah, good. Why is there increased bleeding tendency in EDS, Ehlers-Danlos syndrome? What causes that increased bleeding tendency? What's the defect in Ehlers-Danlos syndrome? Yeah, it's collagen. So what are the different types of collagen? What type of collagen's in bones? Yeah, so good. Type 1 collagen is in bones. Perfect. And then what type of collagen is in glomeruli? Yeah, good. Type 4 collagen. Perfect. Okay, and then the Ehlers-Danlos syndrome, do you know what collagen is usually involved? I think it's usually type 3. Yeah, type 3. Perfect. So that involves the vascular, um, yeah, the vasculature. Perfect. All right. This is an example of blue sclera again, OI. All right. Now, what syndrome is associated with arachnodactyly lens dislocation? Notably, it's upwards and temporal lens dislocation, aortic dissection, and hyperflexible joints. Good, Marfan syndrome. What do you want to distinguish Marfan syndrome with? What high yield disorder that's kind of related to the biochemistry section that will present similarly? Yeah, Men2B is one because that will present with a morphinoid habitus. The other big one is homocystinuria. What is a big differentiator for exam purposes between Marfan syndrome and homocystinuria? Yeah, the big one's the location of the lens dislocation. So in Marfan syndrome, it's up and temporal, and I believe for homocystinuria, it's medial and downwards. So that's kind of the high yield thing to know between those two. Now, what syndrome presents with capillary spots, polycystic fibrous dysplasia, precocious puberty, and endocrine abnormalities? The big one really is precocious puberty and then the cafe au lait spots. Good. McCune-Albright syndrome. So here is an example of Marfan syndrome. So you'll see arachnodactyly, dilation of the aorta, and pectus excavatum. What imaging study do you want to obtain routinely in patients with Marfan? Yeah, good. Echo. And that's again because of the aortic dilation. All right, here's a um, McCune Albright. So you can see that there's these cafe au lait spots. All right, now what condition presents with calf pseudohypertrophy? Yeah, good. Basically any muscular dystrophy, but really you want to think about Duchenne's. Does anyone know the cause of calf pseudohypertrophy? So Where is the weakness typically? What in the kind of the muscle? Where is the muscle weakness in Duchenne's muscular dystrophy? Is it more proximal or distal? So the muscle weakness is actually more proximal. So you'll see that like the pelvic girdle muscles will be weaker, and then your like shoulders will be weaker as well. So patients will basically at first compensate by developing stronger calves. So they'll have truly larger calves with muscular hypertrophy, but then as the condition continues to develop, then that fat base or that muscle basically gets replaced with fat. So that's why it's called pseudohypertrophy. Um, so what other sign is associated with muscular dystrophy, especially Duchenne's muscular dystrophy? Yeah, Gower sign. And the reason for that again is because there's weakness of your the proximal muscles, like the pelvic girdle that you normally would use to like rise. So you push with your extremities, like your arms and your triceps. Okay. Now, all right, we just talked about this, the Gower sign. So here's an example of the Gower sign where you have central proximal muscle weakness, and then so you use your basically your extremities to push yourself up. Okay, what disease is associated with slow progressive muscle weakness, mostly in boys? Yeah, nice. Becker's muscular dystrophy. What's the inheritance of muscular dystrophy, of Becker and Duchenne muscular dystrophy? It's just X-linked. I think it's X-linked recessive because if it were X-linked dominant, then women would have it too, right? So it's just X-linked recessive because it's more common in boys. So, okay. Now, what syndrome is characterized by an infant with cleft lip palate, microcephaly or whole prosencephaly? The big one's polydactyly and then cutis aplasia. Good. I see Patau syndrome in the chat. Uh, and what's the chromosomal abnormality in Patau syndrome? Good. I think it's trisomy 13. So the way I remember Patau syndrome is it's the P's, right? So you have cutis, aplasia, polydactyly, holoprosencephaly, and then cleft palate. All right. Well, okay. What syndrome presents with infant having microcephaly, rocker bottom, feet, clenched hands, and structural heart defect? Yeah, Edwards syndrome. So the one that kind of gives this one away is really the clenched hands. Okay. And then what condition is associated with a single palmar crease? Yeah, good. So Edwards syndrome is trisomy 18, and then single palmar crease is Down syndrome, trisomy 21. Okay, what condition presents with dilated cardiomyopathy, edema, and is caused by alcoholism and malnutrition? Yeah. What? Yeah, good. Wet beriberi. And that's when there's what type of cardiomyopathy? What's the cause of the cardiomyopathy? There's like a specific subtype that you sometimes see tested. It's similar to like hyperthyroidism or like AV shunting. High output, perfect. Yep, high output cardiomyopathy. All right, now what conditions characterized by dermatitis, dementia, and diarrhea? The three Ds. Yeah, pellagra. Where will their rash be? Yeah, good. Sun exposed areas. Photosensitive. They'll be photosensitive. What is pellagra deficiency in? Yeah, niacin, which I think is B3. Good. Okay, what disease presents with swollen gums, mucosal bleeding, poor wound healing, and petechiae? Yeah, scurvy, which is what? Yeah, perfect. Vitamin C deficiency. And then what condition presents with chronic exercise intolerance, with myalgia, fatigue, painful cramps, and myoglobinuria? Yep, McArdle's disease. So what type of disease is McArdle's disease? Yep, glycogen storage disease. I think it's type 4 maybe? Type 4 or 5? I think it's type 5 actually. Yeah, type 5. Okay. So here, what do we see here? What is this showing? Yep, perfect. Corkscrew hairs seen in scurvy. And then here you can see, this is not the best image, but bruising and gingival. You can see gingival, I believe, like bleeding, petechiae. So, ARG, that's right. Pirates used to get scurvy. What did this is a stupid pimp question. This is like what a medicine attending would ask you. But what did sailors used to bring on their ships to prevent scurvy? I can't believe I'm asking this, honestly. I think it's limes. Because pirates used to just live on soda crackers, which is also what med students live on. But luckily, Celsius and vitamin drinks have vitamin C, so you should all be in the clear. Okay, what condition presents with an infant having hypoglycemia and hepatomegaly? Yeah, nice. Um, it's not Pompe disease. Yeah, I'm thinking of a different one here. Hypoglycemia, I think, is what separates this one. There should only be a couple that present with hypoglycemia. Beckwith-Wiedemann's a good thought. Beckwith-Wiedemann does present with hypoglycemia. I'm thinking of a different one. I'm thinking like step one. I don't think I've ever seen this in real life, but step one likes to really go after that. So you have Corey disease. And what does Corey remove? How do you guys remember what Corey disease is? Yeah, debranching enzyme. So if you remember glycogen, it like is a long polymer of glucose, right? And then you have a branch and then you keep going, right? So Corey disease removes this part. And the way I remember it is that Corey cuts the corners. So you like take off the kinked end of the glycogen. And then von Gierke's disease, which is a deficiency. This is like, you know what type von Gierke disease of glycogen storage defect? Yeah, it's type 1. So this is the most severe glycogen storage disorder, and it's type 1. And this is a deficiency in glucose 6. Uh, it's the one that cuts basically what it's a deficiency in the enzyme that removes the glucose chains from the glycogen. So you basically don't have access to glycogen in von Gierke disease. Okay, what disease presents with myopathy and then infantile hypertrophic cardiomyopathy and exercise intolerance? Here you go, Pompe. And yeah, so Pompe disease, type 2, glycogen storage disease, and it affects the pump. So Pompe affects the pump. All right, what conditions are associated with cherry red spots on the macula? There are three. Two are like biochemistry, step one related, and one is more clinically related. All right, we got the two step one ones. So it's Tay-Sachs and Niemann-Pick. Now, what's the other one you want to think about if it's like an adult with new onset cherry red spot? Yeah, embolism. What's the specific name of the diagnosis? Yeah, CRAO, central retinal artery occlusion. So remember the difference between Tay-Sachs and Niemann-Pick is that Tay-Sachs is a ganglioside accumulation, and then Niemann-Pick, you remember that you pick your nose with your finger. So it's Niemann's pick, and then it's a sphingomyelin buildup. And then I think Niemann-Pick is associated with hepatomegaly, but correct me if I'm wrong there. Okay. Now, what disease is associated with hepatomegaly, pancytopenia, osteoporosis, avascular necrosis of the femoral head, and bone crises? It's not sickle cell disease, actually, but good thought. Any other guesses? We're kind of in this biochemistry section right now, so yeah, Gaucher disease. And then what will that look like under histology? What will you see on, I believe, bone biopsy? Yeah, you'll see the vacuoles. I think this is like the crumpled paper look of the macrophages. All right, here's a cherry red spot on the eye. All right, what conditions characterized by Achilles tendon xanthomas? So this is just one of the familial hypercholesterolemias. Good. And then what condition can cause anaphylaxis following blood transfusion? Good. Yeah, total IgA deficiency. What is associated with total IgA deficiency? What condition? Yeah, celiac disease. Good. All right. Here we have some examples of xanthomas. So it's basically cutaneous deposition of fat. All right. Now, what condition presents in a male child with recurrent infections and no mature B cells? We're doing some immunodeficiency. Good. Bruton's disease. What is the inheritance of Bruton disease or Bruton? Yeah, X-linked. So just remember it's B. So male child, B for boys, boys, and then B cells. Okay. What syndromes associated with recurrent cold, abscesses, eczema, high serum IgE, and increased EOS? Yep, used to be called Job syndrome, but hyper IgE syndrome is what you'll see on the exam. So now, what are the high yield conditions associated with the strawberry tongue? Think pediatrics here. Good. One of them is Kawasaki disease. There's one other one. Yeah, associated with pyogenes, scarlet fever. Good. And then what disease presents with abdominal pain, diarrhea, leukocytosis, and recent antibiotic use in adults, like clindamycin? Let's say they're on clindamycin. Yeah, good. C. diff. And what's a complication of C. diff? Yep, toxic megacolon and like pseudomembranous colitis. So here is Kawasaki disease. Do you guys remember the mnemonic for Kawasaki disease? Yeah, crash. So shoot, crash. So what does crash stand for? No. Um, what does crash stand for? Let's start with the C. Good. C stands for conjunctivitis. What does R stand for? Any aspiring dermatologist? Yeah, R stands for rash, and it's kind of a diffuse rash. A, yep, adenopathy. Nice. Two more. S, strawberry tongue. Perfect. One more. Yeah, hands and feet. Good. And then what does a burn stand for? Crash and burn. Yeah, you need to have fever for, I think, at least 3 to 5 days. It might be fever for 5 days. So, what type of this disease is Kawasaki disease? Yeah, it's a vasculitis. Good. Do you know what type of vessel vasculitis? Oh, perfect. Yeah, medium vessel vasculitis. Beautiful. So, what is a common complication of Kawasaki disease? What do you want to look out for? Yeah, you want to look out for coronary vasculature issues. So, what's the treatment for Kawasaki? Yep, coronary aspirin. Good, aspirin. So this is the one time you'll give aspirin to kids. Aspirin IVIG, exactly, perfect. So IVIG basically suppresses the immune system a little bit, and then aspirin is used because of the coronary side effects. Why don't we usually give aspirin to kids if they have like a viral issue? Yeah, we look for Rye syndrome. Well, what is the histology of Rye syndrome? What will you see? Yeah, you'll see microvesicular fatty infiltration. All right, here's a picture of pseudomembranous colitis, which can be associated with both IBD, mostly ulcerative colitis, and then also C. diff. All right, what conditions associated with back pain, fever, night sweats? Yep, cancer, basically, but also I was looking for pot disease. So you can also have prostate cancer, all those things. But you want to be concerned about either cancer or infection. What condition presents with adrenal hemorrhage, hypotension, and DIC? specific name, and the bug as well. Yeah, nice. Waterhouse Friedrichsen, associated with Neisseria meningitidis. Okay, here's a picture of Pott's disease. So this is TB. All right, what condition causes current jelly sputum in alcoholics or diabetic patients? Yeah, good. Klebsiella pneumonia. What condition presents with a large rash with a bullseye appearance? Yeah, perfect. Lyme disease or erythema migrans. Here's a picture of that. And then what disease presents with an ulcerated genital lesion that's non-painful and indurated? Good. What's it called? So it's from syphilis, primary syphilis. Good. It's called, yeah, I was looking for chancre. Um, and the bug there is Treponema pallidum. Let's just quickly talk about syphilis. What's the first step in diagnosis of syphilis? Yeah, you can get like a RPR or VRDL, but then what do you have to do to confirm the diagnosis? Okay, yeah, good. So you start off with your non-treponemal test. So that could include RPR or VRDL. And then to confirm the diagnosis, a lot of time the test answer will be like fluorescence, and that'll be a direct anti-treponemal study. So you need both an indirect treponemal study and a direct treponemal study for confirmation of the diagnosis. Okay, what condition causes painful exudative genital lesions? Yes, HSV. I'm looking for a different one though. Yeah, chancroid, which is Haemophilus ducrei, which do you guys have an acronym for remembering this? Yeah. So Haemophilus ducrei is so painful it makes you want to cry. So that's how you remember this one's painful. Okay, or chancroid has a O, which makes you think of owl. That's good too. So this one's painful, this one is painless. All right. What condition presents with pupil accommodation but no reaction? Yes, it's caused by syphilis. Oh, perfect. So I've got the name. It's neurosyphilis, and this is Argyle Robertson pupil. Does anyone know the nickname for Argyle Robinson pupil that we don't say anymore? Yeah, it's in the chat. I'm not going to say it. Okay, what condition presents with smooth, moist, painless, wart-like white lesions on the genitals? This is also from syphilis. Not goma is close. Yeah, which condyloma? Yeah, condyloma lata. What's the other one called? There's another type of condyloma. Yeah, acuminata. What's acuminata caused by? Good. HPV. What strains of HPV? Yeah, 6 and 11. Perfect. Okay. What conditions associated with fever, chills, headache, and myalgia following antibiotic treatment for syphilis? Yeah, JH. Good. Yerich Herxheimer reaction. You treat it with NSAIDs. It's expected reaction. What infection can result from a dog or cat bite? Okay, yeah, I guess rabies. Not Bartonella. I'm thinking Pastorella. Pastorella is the one you'll see tested more often. And you want to treat with augmentin. Okay, what condition presents with a rash on the palms and soles? There are a few of them. Okay, good. Secondary syphilis, Coxsackie virus, and which Coxsackie virus? And then Rocky Mountain spotted fever. Good. Yep, Coxsackie A. Good. Coxsackie A, which is also called what? What does it cause? Hand, foot, and mouth disease. Good. Secondary syphilis, and then Rocky Mountain spotted fever. Okay. How do we treat Coxsackie A? Yep, supportive treatment. Um, What can Coxsackie 8 be called if it affects the like mouth? Well, the clinical diagnosis, herpangina, good. Secondary syphilis, how do we treat that? Yep, penicillin. And then if it's neurosyphilis, how do we treat neurosyphilis? I think it's ceftriaxone, yeah. And then, or IV penicillin. Um, and then, but if they don't give you penicillin, then it'll be ceftriaxone. And then how do we treat Rocky Mountain spotted fever? Doxycycline, good. So for any tick-borne disease, basically doxycycline will work. Okay, what condition causes a black eschar on the face of a patient with diabetic ketoacidosis? Good. Mucormycosis. What are the genus names of the organisms that cause mucormycosis? Good. The main one you want to think about is Rhizopus, but also the mucor species. Okay, what conditions associated, this is PEDS, with chorioretinitis and intracranial calcifications? Good. Congenital toxo. So this one's toxo because it's intracranial calcifications. Where are the calcifications located in CMV? Good. In CMV, they're periventricular calcifications rather than intracranial calcifications. I also, what would have also given this away is cataracts. So I think toxo presents with cataracts and CMV usually doesn't. Am I remembering that right? I think the big one actually is chorioretinitis. I think I'm wrong. I don't think toxo presents with cataracts. I think that's more rubella. Yeah, okay, I was wrong. All right, what condition presents with a child having a fever, then later developing a red rash on the face spreading to the body? Measles is a good thought, but this one is a fever first and then a rash. So I I'm not going with measles here. Rubeola, is that measles as well? Yeah, it's roseola. Good. Fifth disease, erythema infectiosum. But good thought. Measles also has a cephalocaudal spread, meaning it spreads on the head and goes down. But what gives erythema infectiosum disease away is a lot of times they'll give you like a high fever and then a rash. So that's when you want to think about fifth disease. What is the bug associated with fifth disease? Yeah, Parvo B19. What um, types of cells does Parvo B19 affect? Yeah, it affects erythroid precursor cells or your progenitor cells. What is the pathogenesis? So, like, what body does the parvovirus use to attack cells? I think it's the P bodies. So the reason that's important, I just remember Parvo B19 uses P bodies and affects precursor cells, and then can cause what complication in like sickle cell patients? Yeah, aplastic crisis. So that also has a P in it. So aplastic crisis. Parvo, um, what did I say? Erythema infectiosum. Yeah, parvo is fifth disease. So erythema infectiosum is fifth disease. Did I misspeak? Yeah, roseola is different. Yeah. I don't know what I said, but erythema infectiosum, fifth disease are both parvo 19, B19. Okay. Here is parvo B19. So you have kind of this the classic slapped cheek rash. Okay, what heart condition presents with bounding pulses, wide pulse pressure, diastolic heart murmur, and heart bobbing or head bobbing? Good. Aortic regurgitation. What heart condition is caused by systolic ejection murmur? That's crescendo, decrescendo. Good. Aortic stenosis. What can you hear on the murmur that would make you think of a more severe aortic stenosis? It's not radiating to the carotids. I'm thinking of a different, even more specific sign. Yep, it has to do with the opening snap. So is it the opening snap being earlier or later signifies a more severe aortic stenosis? Good. It's a late peaking murmur for aortic stenosis is indicative of a more severe AS. All right. How do we repair AS? And what's the indication for repairing AS? Good. So anytime the aortic stenosis is symptomatic, there's something called the curve of death. And it's basically that when a patient is diagnosed with AS, let's say they're at 70, um, and this will be survival. When they're diagnosed with AS, they basically, it's called the curve of death, right? So the curve basically looks like this. And depending on what symptoms they have, it's more steep. So I think the most severe one is syncope. There's angina here. This one's syncope is the most severe, I believe. So anytime there's severe, that's an indication for, and one of them's heart failure. And anytime they have symptoms, it's an indication for a TAVR. So what does TAVR stand for? Or they could just have mitral repair. Yeah, TAVR, trans aortic valve replacement. So usually that's when they go in through the femoral artery. So here's the heart, and they go in through the femoral artery, and then they replace the valve. But they can also do it open if they're not a TAVR candidate. Okay, yeah, that's the main one. They're also, if they have severe AS, so that's all just biomechanics of the valve itself. So I believe 70% stenosis is an indication. And then also if the opening velocity, I think is 3. I believe those are right. Okay. All right. Moving on. What heart condition presents with a continuous machine-like heart murmur? Good. PDA. Where are you gonna best hear the machine-like murmur? Where do they kind of say? Yeah, it's usually the mid clavicle, I believe. What heart murmur can you hear in like the intercostal, interscapular region on the back? I'm thinking of colorectal of the aorta, but I don't know if I'm remembering that right. But yeah, PDA. How do we close the PDA in newborns? Good. Indomethacin. How do we keep a PDA open? Good. Prostaglandin. PGE1 is the main one. All right. What condition presents with chest pain on exertion? This one, don't overthink it. Yeah, just classic angina or stable angina. Okay. What condition causes chest pain, pericardial effusion, and persistent fever several weeks after MI? All right, good. Dressler syndrome. And what exactly is Dressler syndrome? Good. It's an autoimmune pericarditis. How do we treat Dressler syndrome? Yeah, here you can use NSAIDs. What's another cause of pericarditis after an MI? Not free wall rupture. That'd be a cause of like cardiac tamponade. I'm thinking just of yeah, fibrous pericarditis. Do we want to use NSAIDs for fibrous pericarditis? No. Yeah, that's the right answer. Nope. But what NSAID can we use? There's one medication we can use for fibrous pericarditis. Not colchicine. I'm thinking of aspirin. I know you can use aspirin. All right. What conditions associated with painful raised red lesions on the pads of the fingers and toes? Yep, it's infectious endocarditis. What are the lesions called? Yep, Osler nodes. So you want to remember, I don't know if any of you watched Pathoma, but it's ouch, ouch, Osler. So that's how you differentiate Osler nodes and Janeway lesions. Where do Janeway lesions affect? I think Janeway lesions are usually in the palms, whereas Osler nodes are on the fingers and toes, like the distal extrem, like the most distal extremities. All right, I think we talked about this one already. What conditions associated with cervical lymphadenopathy, desquamating rash, coronary aneurysm, red conjunctiva, and hand and foot changes? Good. Kawasaki disease, crash and burn, right? What condition presents with palpable purpura, joint pain, abdominal pain, and hematuria? Good. So HSP, that's what we used to call it. What does HSP stand for? Yep, Henoch-Schönlein. And then what is the new name for it? Good. IgA vasculitis. So, okay. What is the most common trigger for HSP or IgA vasculitis? Yeah, usually, yeah, any viral infection basically can cause HSP. All right, what condition is associated by, oh, and what's treatment for HSP? Good, usually just supportive management. All right, what conditions associated with telangiectasia as recurrent epistaxis, skin discoloration, AV malformations, GI bleeding, and hematuria? The main one is you want to recurrent epistaxis, the AV malformations. Let's say they have like lip. Sometimes they can have like lip lesions. Good. I see HHT in the chat. What does HHT stand for? Let's give it a shot. Good. Yeah, perfect. Hereditary hemorrhagic telangiectasia. So what other condition can present with lip macules? It's one of the inherited cancer syndromes. Not Lynch syndrome, but close. I believe it's associated with P53 mutation. Not FAP. FAP is associated, or not, FAP is associated with APC mutation. It's not Li-Fraumeni. Sorry, Li-Fraumeni is associated with P53, though. I think I misspoke. It's Peutz-Jeghers syndrome. Peutz-Jeghers is associated with, let me think. It's a STK11 gene, STK11 gene. It's Peutz-Jeghers syndrome. Does that ring a bell? Yeah, macules on the lips, inherited cancer syndrome. Exactly. So the way you want to differentiate Peutz-Jeghers syndrome and HHT is that Peutz-Jeghers syndrome doesn't really present with the recurrent epistaxis or AV malformations. If you see the lip macules and epistaxis, you want to think about HHT. Whereas if you think about like inherited cancer syndrome and macules on the lips, then you think about Peutz-Jeghers syndrome, which is a mutation in this STK11 gene. And then Li-Fraumeni syndrome is the mutation of P53 gene. All right. Next, what condition presents with, and if you need a refresher on the inherited cancer syndromes, we have a video on it that Xander can link in the chat. What condition presents with skin hyperpigmentation, hypotension, and fatigue? And there's increased ACTH and then increased alpha MSH. Good. Addison's disease. What is Addison's disease? Yeah, good. Primary adrenal insufficiency. So ACTH shares a subunit. So increasing ACTH will in turn increase the MSH, which is melanocyte stimulating hormone, which is what leads to the hyperpigmentation. So you can also often look into hyperpigmentation, into used hyperpigmentation to differentiate between like a primary and secondary adrenal insufficiency. So what's the cause of primary adrenal insufficiency? Yeah, good, autoimmune. So there, will your potassium be normal or what is it? High in primary adrenal insufficiency? Yeah, good. You don't have adequate potassium regulation because you're not producing any aldosterone. What about in secondary adrenal insufficiency? What's the deficit there, and what is the electrolyte panel going to look like? Yeah, so it's extra renal. This is extremely high yield. I'm glad you bring it up. So in primary adrenal insufficiency, your potassium will be high, okay, because you're not producing any aldosterone. In secondary adrenal insufficiency, your potassium will actually be about normal because you still produce a tiny bit of aldosterone and it's enough to regulate your potassium. And the cause of secondary um, adrenal insufficiency is because of a deficit in what hormone? ACTH, exactly. So primary adrenal insufficiency, you have an issue of the adrenal gland itself. So you have increased ACTH and you get skin hyperpigmentation and your potassium will be high. In secondary hyperpar or in secondary adrenal insufficiency, your ACTH will be high. Or in secondary adrenal insufficiency, your ACTH will be low because you're not producing ACTH. So you don't get skin hyperpigmentation and your potassium will be about normal because you're still producing enough aldosterone to kind of regulate your potassium level. Does that all make sense? I know I kind of janked up the explanation, but all right, I'll take the silence as a yes. Waterhouse-Friderichsen can cause adrenal insufficiency, yeah. So Waterhouse-Friderichsen, again, is when you basically have the severe sepsis. Um, Picture from Neisseria meningitidis, and then you'll get infarct of the adrenal gland, so it can cause adrenal insufficiency, and that would be a form of primary adrenal insufficiency. So you'd have a similar look, and the main thing you want to look out for primary adrenal insufficiency is hypotension that you replete with steroids. What's tertiary adrenal insufficiency? I think I think a tertiary adrenal insufficiency is a deficiency when you are like withdrawing from steroids, if I remember correctly. Does that sound right? I think so. I think tertiary adrenal insufficiency is when you're exposed to steroids long term, like prednisone. So look for tertiary insufficiency will present in a patient like that has lupus or something or rheumatoid arthritis, and they're on prednisone at baseline, and then let's say they go to the hospital and then they stop the prednisone, and then all of a sudden they're hypotensive. That will be tertiary adrenal insufficiency because you have chronic suppression of the adrenal glands, and then when the adrenals aren't able to compensate in times of stress like surgery, so you can get hypotension. Whereas normally your adrenal glands would increase the amount of cortisol they produce in response to like a acute insult. So what do we use to treat tertiary adrenal insufficiency? There's a specific steroid we use, super high yield. It's not prednisolone. It starts with a H. Yeah, I believe it's hydrocortisone. So that's basically your replacement for aldosterone or cortisol. Does that all make sense? You're all right. Sounds good to me. All right. What conditions characterized by cutaneous edema due to the deposition of mucopolysaccharides in connective tissue? It's not Hurler or Hunter, but that's a good thought. Yeah, good. Myxedema. What is myxedema associated with? Yeah, what about the thyroid? So I'm looking actually for Graves' disease, but it can be associated with hypothyroidism as well. But Graves' disease specifically will cause myxedema, and the reason why does Graves cause myxedema? Yeah, it's actually not the overstimulation that causes deposition. So I don't know if you guys remember all in endocrine, but a lot of the subunits of all the different hormones have a lot of the different hormones share subunits. So the TRH antibody that's produced in Graves' disease actually stimulates fibroblasts in the skin to produce more connective tissue, basically. So mucopolysaccharides. What ophthalmologic side effect can be seen in Graves' disease? Yeah, Graves' eye disease, exophthalmos is what I'm looking for. And what is treatment? Does exophthalmos get better with treatment of Graves' disease with radioactive iodine? No, it doesn't. It can actually get worse. So what do we use to treat exophthalmos and Graves' disease? Yeah, good. Glucocorticoids. All right. We'll do one more, then I could open the floor to questions. So what sign is characterized by facial muscle spasm upon tapping? Yep. It's associated with hypocalcemia, um, and Chvostek sign. All right. So that's all we've got, I think, for now. So thanks Xander for organizing this.